And with me now is Tom Blonski, the president and CEO of Catholic Charities, which is celebrating its 75th year of helping our community. So I'd like to introduce Tom and have you give us a few words of what's happening that's different, better, and what are you learning from these experiences right now as you help support the community. Welcome, Tom.
Thank you. I appreciate that. Well, you know, for 75 years throughout New Hampshire, we as the social service arm of the Church of the Catholic Church in New Hampshire, we have responded to and adapted to the changing needs in our communities around the state. So we're very humbled and proud to be able to do that and serve people from all faiths and all backgrounds on a daily basis. And this time is no different during this pandemic, and how we're yet again adapting some of our programs to address some of the needs out there. Whether it be through mental health counseling, offering telehealth therapy services, our numbers just in the last couple of weeks are over 140 people who have called in. Some of our own healthcare workers in the hospitals and at nursing homes around the state who are on the front lines dealing with the stress and anxiety of what they're dealing with every day. So we're very blessed and fortunate to be able to provide that type of service, for example, or continuing to offer services for homeless vets at Liberty House, or ensuring the safety and the dignity of our residents in our 7 nursing facilities around the state to ensure that we have adequate PPE supplies and following very rigid infection control policies to ensure that our staff and residents are safe.
Well, let's talk about people on the first line today, right, at hospitals and services. For their protection, hopefully with the shipment we've just heard that's come in of all kinds of PPEs and masks, some of those concerns are taken care of. But how about the emotional side? You come off a shift, it's got to be brutal. How does Catholic Charities, what's your support service look like there?
So like I mentioned earlier, we have our telehealth counseling services where our counselors are able to respond telephonically to any type of crisis that comes up, whether someone is struggling with anxiety or depression or even loneliness. That has come up a lot in recent weeks as well. So, and then really spending some time to find out what their story is. You know, is there a greater need, and how far does the blanket need to be cast in terms of how is the family doing? How is the extended family doing? Is there enough food on the table? Is there a need for maybe we set up an emergency crisis fund? Is there a need for financial assistance to help with utility bills or potentially rent or food procurement? We also have the New Hampshire Food Bank, which is firing on 12 cylinders, not even 8 cylinders, and doubling their food production capacity at our culinary training kitchen, and now resorting to have to purchase more food because we're not getting as many donated items. So we're really responding in a number of different ways. Aside from that, for seniors who are isolated in our community and are living alone in our community, we have our caregivers program and our Monadnock at Home program, where we're not only doing food delivery to seniors in the community who are not able to get out of their homes, but also offering transportation for medical appointments, and also doing comfort calls in order to check in with them just to ensure their well-being. And we found that some of them, after calling them, at least with the initial call, hadn't really had any contact with the outside or anyone from the outside, and some of them for up to several weeks. And now they're on a regular call with some of our staff, you know, at least a couple of times a week. So a lot of good coming out of this, and a lot of relationship building and a lot of reconnections and all that. And it's just, it's amazing to see the gratitude, you know, from both perspectives. And you wonder if we're getting more out of it sometimes than the end
caregiver, right? And the person, absolutely, the caregiver and the person receiving it. You know, I listened to you talk, and it's so clear that your organization and you yourself represent advocacy, and it's an advocacy for people who can't always speak up for their own needs or may not even realize what they are. And it's such an important. I mean, these are the unsung heroes that I really care about and want others to hear about, because it adds value. It's what makes community and civilization real. And it's how we take care of the least able to take care of themselves. I think that defines a community or a civilization. And it's a wonderful thing. Is there any unique lesson learned that's come out of, as we overnight, we're all thrown into many social distancing and virtual even conversations like this that would normally take place in person. Anything that's jumped to mind that you've learned or your organization is learning or using differently because of the tools available?
I think, just to give you something, very on the very, very basic level is we really can't make assumptions and make judgments until we know people's stories. What you see is not always what you get. And we really need to drop all kind of pretenses to really take the time to meet people where they are, take in their story, really figure out how to get to a solution from there, because we have no idea what the stress in people's lives and what they're going home to face or what their work to face, and trying to be as empathic and responsive as we can, and just really being a neighbor to each other. I mean, now is the time to pull out all the good we can and show, look for the goodness in each other, and work as a community and work as a state to make this work for everyone, and collaboratively, rather than just figuring out who's doing what or who needs to do more, who isn't doing enough. There's a lot of good happening out there.
It's not
with our governor and our nonprofits, and I'm grateful for that, and I'm grateful to be part of that. But there's a lot of people doing a lot of good, at the hospital level there, and we're very blessed, with everything happening and all those who have stepped up to the plate.
It's a very powerful. You're very proud of the people that are in your organization, and that's clear. And you remind me of that comment we used to hear. It's almost going back in time. People go, "Hey, how you doing?" and keep walking. And now what you're really saying is, "How are you? How are you doing? And what do you need?" And I think that's so important. And as an end note for this conversation, is there anything that you need, that your organization needs? Is there anything, people who hear this that want to take action, are there things that would make a difference? Is it advocacy at other levels? How do we help you advocate?
Yeah, advocacy is always helpful. Just remembering our seniors in the community who we serve, or in our nursing facilities that we serve. That's important, and ensure that we're adequately funded via Medicaid and Medicare, certainly, so we can pay our staff fair wages, which is always important. And then our social service programs, which we don't receive, we fundraise for all of our social service programs. We receive minimal to none state or federal dollars for those programs, including the food bank. So we have some of our largest fundraisers in the spring that are a concern as to how those will move forward, but that is always helpful as well. We have an emergency crisis fund out there to help people in need as we speak. We're just shy of $20,000 toward our goal of $250,000, but so there's help that can be met at any of those levels, whether it's at the food bank or other social service programs at Catholic Charities. So great. I'm grateful for all, everyone who stepped up to the plate thus far, and our long-term supporters, and appreciate all that you're doing as well, just to showcase what everyone is doing around the state, step up to the plate during this critical time.
Thank you, Tom. It's been a pleasure talking to you, and I'll post contact information, because I think there's a lot on the website that really talks about services, compassion, places to turn if people haven't thought about what they need. You guys certainly have. Much appreciated. Have a great day. Thank you.
You too. Thanks so much, Keith.